So we have all experienced the increase in healthcare, and it is getting ridiculous. It's beyond ridiculous. So for the past 7 or 8 years that I owned my heating and air conditioning company, I had the privilege of working with Claimlinx, and Tom Quigley is the owner. And I'm interviewing him today, so we get to talk about health insurance, how to lower your cost, how to increase the bottom line, and make your employees happier. So let me tell you a little bit about Tom. He grew up in Central Massachusetts and graduated from Central Michigan University. He's been in the insurance industry since 1994, almost as long as I had been in business. And he formed Claimlinx in 2004 with his wife, Christy, and they have been married for 25 years. They have 2 children and now a granddaughter, with a grandson coming in February. So congratulations, Tom. And again, we're going to be talking about health insurance. It's very informative. Most of this stuff I didn't know until I met Tom, and we were able to save thousands of dollars, not just a year, tens of thousands over the 7-year period or so that I worked with Tom. So that's what we're going to talk about today. Hey, this is Greg McAfee, and welcome to the Greg McAfee Show. Now let's get started. Hey, welcome back to the Greg McAfee Show. And I'll tell you, with healthcare prices going up like they are, it is mind-boggling. It really is. And I hope something can be done about this soon and still keep the quality of healthcare in America. Today, we have a guest, Tom Quigley, who I have basically worked with for 7 to 8 years when I owned the heating and air conditioning company. And Tom, like I said, owns Claimlinx, and we're going to talk about a primary coverage, secondary coverage. And so today, welcome to the show, Tom.
Well, thanks for having me.
And, a lot of the Greg McAfee Show viewers, listeners, probably don't know much about healthcare insurance. All we know is that it's extremely high. And I know for our company, it was extremely high, and it just kept getting higher. So we're gonna talk about that today. How, I've had a couple people reach out to me and say, how can we afford healthcare insurance for our small business of anywhere from 5 employees to 100 employees? How can we afford this? So, Tom, my first question is, what is Claimlinx, your company? Tell us a little bit about that so we can, in layman terms, so we can understand it as business owners.
Sure. So Claimlinx was formed in 2004 by my charming wife and myself, and we came up with an idea how to keep health insurance costs down and benefits better for employers and employees. And what we do is we're an insurance agency to manage the insurance products. We're a management company of a medical expense reimbursement plan. That's the key to keeping the costs down. And we manage the whole process, paying claims to doctors and pharmacies. And what we do is we handle the ins and outs, the stuff that everyone gets upset about, having problems with the insurance carriers, fighting over whether you were injured on the job or if it was off the job, all kinds of items that happen and arise. And then we help, we're also a consulting company because the majority of our income comes from what we save you. So I work on 20% of actual savings, and every company I made, it's impossible not to save 20% and improve benefits for the employees because of math. That's the key. It's just, it's a system that's flawed.
Definitely. And I know, again, you worked with us 7 or 8 years and we started saving money right away. And we'll talk more about this, but
Sure.
I know when we were trying to buy health insurance on our own, or if we had some advisor, we were getting one policy for the entire company, and we had older people, younger people, and and when we went with you guys, you separated the young people from the older people, and the young people had a much less premium for their policy, which worked out great for them. I think we had, I don't know, 95%, 90% or so on health insurance because they could afford it. It was more affordable, put it that way.
Right.
And then when we would go to a doctor's office or any emergency room or anything, we had a primary and a secondary, and we'll talk more about that as
Sure.
well. What most business owners or companies don't realize is that they overlook what it takes to have health insurance, and a lot of them don't provide health insurance, and then their employees they don't go out and get it, and we've got people now without health insurance. And what does that do? What does that do for health insurance? Does it cause the rates to go up?
Well, the insurance companies would like you to think so, but quite frankly, the health insurance carriers are using the ACA and the HIPAA laws to inflate rates. It's just a game. They're all stock companies trying to please Wall Street. I'm sitting there going, okay, here's the rules, here's the game. This is how you win. So the uninsured people, they're costing money, but they're not making a lot of money. The hospitals have grants that cover all the out of pocket anyways for
Interesting.
both people who are uninsured and they call them underinsured with the high deductibles. And they don't publicize these grants, so people don't know. So it's just it's all game. So all I'm doing is winning the game. Each company has to look at it differently. You alluded to the older folks and people with health conditions. What I never understood about how people are selling health insurance is they're selling one policy and you throw everyone on. And if you have a cancer or you have a AIDS or a hemophiliac, they jack the rates up, particularly on groups above 50 and those who are on what's called level funded health plans. And then they sit there, and if those people quit, pass on, whatever the story is, they don't come back and lower the rates because the risk is less.
Right.
So what I'm doing is I'm just showing people don't do that. Don't take advantage of don't allow them to take advantage of you. Take control of your health insurance. Is all the law states is that you have to provide the same benefits at the same cost. Nowhere does it say that you have to buy the same insurance on every single person. The insurance agents would like you to think that because they're making money based off what you pay. So every year when you get a rate increase, they're getting a raise. It's insane. And
So,
companies are sitting there.
so um, the health insurance companies that sell small business health insurance, they get
Mhm.
commission for how much our premiums are. Is that right?
Your a lot of times, if not their
Rates.
bonuses, they have like a block of business and they get a bonus from the carriers that they're all based on premium. So you get a large insurance agency, they have $100 million, they're making $6 million just on bonuses.
Wow.
So what incentive do they have to cut your rates to 20 million?
Right.
None.
Right.
No offense, I wouldn't give up $5 million off of a system that's paying me 6 million and to cut it to 1 million. Why would you do that? Where my system, I come in, I go, okay, you got $100 million. I cut it to 20 million. I make 20% of 80 million. So I actually make more,
So let's
but
just,
everyone wins.
right, let's break it down for people that are watching that still that they don't understand. So
Sure.
I have group health insurance.
Hmm.
I hire you. I call you and I hire you. What
Yep.
what does what does it cost? What does that cost me between me and you, or do you just make your money off the savings?
I make my money off what I save you. So say you have a 5, 6 person group paying 6, 7 thousand a month. I come in and I say, okay, why are we buying a group health plan from United or Anthem or any of the flavors this way? Let's look at the lowest cost option they will sell you and let's do the math because it's a math problem. So they say, okay, we have a $5,000 deductible currently. And I go, okay, and we have copays. I say, let's get rid of the copays and let's make it a $7,000 deductible, 100% after. Everything goes towards the deductible. And they go, okay. And I go, okay. So your 6,000 a month goes down to 4. So you save it 2,000, 2,000, 24,000 a year. Well, if you have 6 people, you're saving 4,000 a person. If your risk is 2,000, no offense, if they use it, you're guaranteed to save 2,000. So if the whole premise is to transfer risk, why are you giving the insurance company more money than the risk? That's what everyone is doing. Everyone.
Because we don't know better.
Because you get a spreadsheet each year and they say choose one and your rates are going up, oh, by the way, 20%. But if we raise this deductible and raise the copays, now it's only 10. And they think they're heroes. And I sit there and I'm like, if you raised your rates 10% every year, what would happen? And almost everyone says we wouldn't have clients. And I'm like, so why is that a good deal?
I know. I remember talking to you when we first signed up, and
I
I
think
just
I
thought
said
this,
exactly that.
yeah, and I just thought this sounds too good to be true, um, because I had never heard of it, and that's what I've been telling a few people. Actually started off as a text or a messenger text and led to, I'm just going to call you for a minute because I want to understand this, and I know enough to be dangerous. So I said, hey, I'm going to do a podcast with Tom. And I think I hooked a few people up. I don't know if you've talked to anyone yet or not, but
I believe so.
it's people need to hear this because we don't know what we don't know, and we're going through the motions. And if you saving when they contract with you and you handle this part of it, the savings they have, I tell business owners all the time, goes directly to the bottom line of their business. And I've told people on my show for years, in the last couple of years, we've been averaging between 20 and 30% net profits, which are huge. And
Mhm.
part of that has to do with the savings through our health insurance plan through you guys. I mean, we were saving
Right.
thousands of dollars, tens of thousands of dollars, if not over the 7 or 8 years, who knows how much we had saved. And it was good for
Right.
our team. It was good for our employees. It was affordable. I know a lot of times when people are on straight health insurance plans, like I said, they can't afford employees can't afford somebody in 21, 22, 25 years old. First of all, they're going to say we're going to take a chance anyway. We're young. But if it's affordable, they'll go with it, especially if they're married and have, a child. They need health
Yep.
insurance. So, if it sounds too good to be true, this one it isn't. It's possible. It's a service provided through ClaimLinx through Tom, and it is something that you got to give it a shot to find out just how good it is because you guys handled a lot of, for a company, we had a good sized team and we had a leadership team and we had people who actually shopped health insurance and bought health insurance. But for a lot of guys with 6 or 10 people, they're doing it on their own. It's just a hassle. It takes a lot of time. That's money.
Yeah,
And then you
it's like,
don't know who to go with.
well, it's a
So,
headache, and it's
what
one of the yeah. The biggest thing that people have to keep in mind is it's math, and the way that it's being sold currently. It's like a algebra word problem. Train going 30 miles north meets the one coming 50 miles south at what point? And the answer should be who cares? And you get an F in algebra, and having two parents who are school teachers, retired Massachusetts schools teachers, they didn't really think my humor was funny. So you have to figure out, and back then, your parents could actually do something to you.
right?
So you literally, you got smart real quick and said, "Oh yeah," so you got to go the formula. So what I'm doing for insurance, health insurance, is here's the formula. Now we can do the math, and once they see the math, they go, "Wait a minute," and it's believable because you got the ACA, the HIPAA, they're all tax laws, and people are, like I tell people, you can pay the IRS more money than you have to, they accept, or you can take advantage of tax breaks. And if both of them are perfectly legal, well, with health insurance, it's the same way. You can give the insurance company more money than the risk, perfectly legal, or you can take advantage of the tax breaks associated with laws dating back to 1954, and that's also perfectly legal. Obviously, the insurance agents don't like those laws because it makes people make informed and logical decisions. And by making informed and logical decisions, you win the game because you're saving. And think about this, $100,000 savings in your EBITDA factor 7, you increase the value of your company by 700,000. And if you're running at a 10% profit margin, that's $1 million sales. How many $1 million sales do you make in a year? I don't know. And that's overnight because it's going from a liability right to the asset. It's huge.
It is. And I know a lot of times companies, small businesses keep their health insurance because they don't want a backlash from their employees, because when they do change
Right.
it, the deductibles go up, all this stuff. So what kind when going with ClaimLinx, it's I think I know the answer. It's quite the opposite. But how does that work?
Create a zero deductible most of the time and make everything a copay. So people actually understand their health insurance. I'll give myself as an example. My shoulder's kind of shot from 50 plus years of ice hockey. Um, they're saying you need a replacement, blah, blah, blah. So I'm like, okay, um, you got to go with it. But the MRI I had to have for them to inform me of this good news was I had a choice. I could go to the hospital, it was $2,000, or I went to the Pro Scan down at Cincy, $400. Well, you can design your plan underneath the high deductible so that everyone has copays to incentivize them to be smart. So if they want to go to the hospital and pay 2,000, great, they get to do so. But if they want to take advantage of other facilities, it's the same MRI machine, they can do so also. And you incentivize them by making your copays logical, making the urgent care and the telemed and all that very low, so that they don't use the emergency room and cost thousands of dollars. It's crazy, but no one understands the gibberish that's on their current health plan. So coming in and saying, okay, educate the employees, you pay no more than this. If you're asked to pay more than that, you need to contact us. And that's what we do.
Yeah, so I said we saved thousands of dollars. What is for an average company? What kind of, maybe percentage wise, what kind of savings do they see?
Usually between 4 and 6,000 an employee
Wow.
a year of actual savings. I have a country club in Minnesota today, and individual health insurance in Minnesota with the same network, same insurance carrier, is 62% less than what they're paying on group.
Yeah, it's amazing.
And they don't realize the tax law doesn't care if you use individual health insurance, spouses plans, military, Medicare, Medicaid, group health. They don't care. That's the misnomer. You don't have to just buy group health insurance to provide benefits. And I think that's where everyone's really making their mistakes. If you have fewer than 50 employees, you should have an unaffordable health plan on paper and allow the employees to get subsidies if they qualify. So we have some people paying zero premiums because their tax credit is greater than the cost. And people are missing this.
Sure.
And they're
We're
paying
ignorant.
2,000 a family when they can be paying zero.
Yeah, we're ignorant to it. It's over our head. They make it difficult on purpose.
Mm-hmm.
And that's why we stayed with you the entire time since the conception of when we found you. So if this works so well, and it worked well for us, that's why I'm talking to you today on my podcast.
Sure.
Why don't more business owners know about it?
Because business owners hate health insurance so much, they allow their HR directors or office managers to make the decisions for their second or third biggest expense when they should be involved with their CFOs or their outside accountants, tax attorneys. If I get any of those involved and they're unbiased, not a fraternity brother who's selling them the goods, 90% of them listen to me. It's getting them to sit down, taking the half hour to understand why they're giving away so much money, and to get out of their heads, get them out of, debug them for, what they've been told the last 30 years on health insurance. It's really, but when you put the math to them, it's easy. It's getting them to agree to allow you to show them the math. And then they think I'm trying to sell them health insurance. And it's like, no, it's the opposite. I'm trying to show you how not to get ripped off and how to save money.
Mhm.
And I only get paid if I save you money.
I know that's the good part. Um, who is not a good fit for Claimlinx?
I help anyone, even a 1-2 person group. They should be doing health savings accounts. I had a 4-person group yesterday in Florida, and they were paying $5,000 a month. And I said, okay, let's look at this. All your out of pocket currently and all your premiums you're paying with after tax dollars, your employees, the 3 employees. You as an employer, you write it off, you get your K1, write it off. But here's the deal. The one family paying $1,400, the premium on the group plan is $1,300. And they go, but it's not really $1,300. It's pre-tax now because of a Section 125 premium only plan, because a medical expense reimbursement plan is considered a group plan under ERISA federal law. And for that, you can use Section 125 premium only plan, so the employee's contributions can be pre-tax. Saves them another 30-40% of, that was after taxes now before. And the employer wins because they don't pay FICA FUTA. And I said to them, okay, that's phase one. I go, they made too much to get subsidies. So I was like, no big deal. I go, but at least now your 3 employees get to buy their insurance pre-tax. Something as simple as that.
Yeah.
And then the employer, I said to him, I go, you're making a mistake because, yeah, you get to pay, the 1,800, whatever you're paying, but here's the deal. You need to do what's called a health savings account. So you throw all that money in tax-free so that the amount you're using on medical and dental and vision It's pre-tax, coming out tax-free. And they were like, wow. So that's what everyone's missing, even the small ones. If they're a C corp, I have people out there, Minnesota, California, where they have a C corp, and literally and they put all their business expenses, everything through the C corp. They show very little income. They get their health insurance at no cost because they don't care if you have that $1 million home in Malibu and you have that 10 million sitting in an account. They only care about your federal tax return, what you're showing for 2026.
Interesting.
Yeah, it's just a game. It really is just a game. It's no, and each, it's like the football playoffs. I'm from New England, so the Patriots' game plan against Denver is going to be different than it was against Houston or the Chargers that they won. It's the same deal with health insurance. Company A, I'm going to do this, B, that, because, it's a different scheme, what they have. And that's all I do.
How does it work for, let's say someone like me who sold their business, they're no longer on their company plan. Their wife's on a separate plan or spouse, and they go out to get health insurance, and it's of course extremely high, or it's high for one person.
Mhm.
Would you'd be able to work with them?
Right. So, for example, I'll use myself. A lot of people don't know this one, the Inflation Reduction Act that, you heard on the news, and then the big beautiful bill.
Right.
Um, well, both of them, you have a huge opportunity. So the government states that you can purchase solar equipment. And I use a company called Solar Systems out of St. Louis area. And they literally, you purchase the equipment with your last 3 years. I'm getting all 3 years of my federal taxes, 21, 22, and 23 back to purchase the solar equipment. 24, I didn't pay any federal taxes, and in 25, I won't because of the depreciation. So each month I get 1,100 put in my account on the first, and I take out 780. So you're using your federal tax dollars. You're getting them all back from the three previous years. I did it in December 24. So if somebody does it this year, say December 26 or November, you get your 23, 4, and 5 taxes all back federal to pay for it. And then you pay, because of the big beautiful bill, you get 100% depreciation right off.
So I can do that now.
So, yeah. So what then happens is you go back um, for this year for your health insurance. If you're doing that, you're showing very little, if any, income. So you get your health insurance at no cost.
Oh my goodness.
It's a game.
I'll call. We'll be talking more about that. But there's a lot of guys out there like me that have listened to this show, and they've sold their company, and they still are. They're semi-retired, and they still need health insurance. So,
ESOPs are another good source. If you do an employee stock option program, you don't pay any capital gains.
yeah, I need to talk to you more about that. So that's
Yeah,
that's
there's
good to
all
know.
kinds of games out there. But see, these are all tax breaks. Like I stated, the IRS, you can pay all those taxes, or you can take advantage of the tax breaks. And it's both of them are perfectly legal. It's just a matter of, do you want that? There's another one, a jet airplane. You put down 100,000, you get $1 million of depreciation in a revenue stream. They rent them to like NetJets and those folks. You never fly on your plane, but you own it. Part of it.
Hmm.
Yeah, it's a 10-to-1 ratio.
Interesting.
There's so many things because of all the tax breaks that have been created with all these tax laws. And the health insurance is no different. The problem is people, they're relying on commission salespeople who work for the insurance company because that's how they're getting paid. Whoever pays you is who you work for. I hate to break the news to a lot of people, but that's how it is. So when they hire me, I work for you. I'm getting paid based on what I save you, so that's how I get paid.
I
Most
know.
owners love that.
I do.
Yeah.
Exactly.
And most insurance agents say, well, your fees are too high. I go, compared to what?
Exactly. Yeah. When I sold my business and I had my broker on here, Fred, he didn't charge me one dime till we sold. And
Exactly.
they did all the due diligence, worked hard, all that, for 5 months.
All
But
right.
he didn't collect one penny until he sold. And
That's right.
like you said, owners love that. Um,
Works for you.
exactly.
Why? Because we all have an incentive to save you as much or get as much for the value of your company because we get paid more. I have no problem with that. I think that's how health insurance, any insurance should be. But the problem is it's a pyramid scheme. It's kind of like the lobster, you go to Portland, Maine, you hang out at the dock and the lobster, they're not supposed to, but they'll sell you some lobsters for a few bucks. That same lobster, if it travels to Florida or the Midwest or wherever, it's 12, 13 bucks because of all the middlemen
Sure.
and cost of everything. But health insurance is no different. You got the general agents, you got the agents, the sub agents. I mean, it's crazy. Same deal. Everyone wants to be paid.
And every business owner wants to save money because what you just said about the savings, if you have 10 employees, you're saving between 40 and 60,000. If you have
Yes.
100 employees, you're saving between what,
400
400
and
and a half million.
600,000
Yeah.
worst case.
So, and again, that goes to the bottom line. You were spending it anyway. Um, so a few more questions here.
Sure.
Where do you see employer provided or small business healthcare going in the next 5 to 10 years?
I've been, my wife said that she thought we had a 3 to 4 year time frame when we started 25 years ago, roughly. And here we are still dealing with the same stuff. The insurance agents are trying to sell it the same way.
Yeah.
But I do think that the bubble's got to burst. I mean, paying over 3 or 4 thousand a family a month, you got to sometime go. There's got to be a better way. There is, but the 3, 4 years. I mean, if the government wanted to solve health insurance, this is how easy it is. You have two methods. First one, put a $50,000 deductible on every American. Underneath it, they can self-fund, no more bankruptcy, or they can buy insurance. But the insurance cost will be so much lower because there's no risk after 50. So the government right now, if a company's paying, let's say, a small company at 10's paying 200,000 a year, how much of that does Uncle Sam get? And the answer is none because it's tax-free dollars to the employee and the employer writes it off. Well, if you do what I just said and the premium goes down to 20,000 a year, that 180,000 is now taxable. They just create the taxable income will pay for the reinsurance the government pays for above 50,000. Period. Solved it instantly. Done. And then you have other people getting involved, and you have companies who are mid-sized self-funding now because they only have a $50,000 risk. So now they can give the employees better benefits than they ever had just because of all the savings. Or if they want to do it, the other method is take the high risk people, subsidize it. Same philosophy that lowers the insurance costs, which the money that is created by taxable income pays for that also. Too much greed, too many lobbyists.
Yeah.
That's
Big
the
time.
problem.
Preaching to the choir there for sure.
It's that it really is that easy to solve it. It's
What if
not hard.
what if someone's watching or listening today and they just re-upped, so they have a new plan for a whole year,
Mhm.
and they just heard about you? Can you go ahead and work with them now, or do you have to wait?
Yes, the misnomer is that you can only do something at renewals. I call it the rip-off period when they rip you off further. But you can do several of the methods anytime during the year. So you don't have to wait to save money. It's just the insurance carriers. The problem that a lot of people don't realize they have is they got to abide by the ACA and the HIPAA laws also. And because the way we're taking advantage of those laws, we create qualifying life events all year round, which enables them to start saving immediately.
Okay. Anything else? I want you to tell the viewers how to get a hold of you best, or give a couple different ways. But anything else before that somebody would need to know, or should know?
There's all kinds of tax breaks, and there's all kinds of math that, if done, can dramatically, if not decrease your costs down to what you were paying in 2004 versus 2026.
Wow.
And better benefits, because back in 2004, people had $500 deductibles they were complaining about.
Yeah.
I mean, think about a $5,000 deductible if an employee hits it. Every hour they work for you, that's roughly $2.41. They're paying out of their paycheck after tax most of the time. So if you think about that, you take 40 times 52, and 2080 divided into 5,000, and then you're asking them to pay. So now you're spending, like, employees spending $4, some pre-tax, some after, if they use the insurance. And the whole idea of providing benefits is to retain and attract employees. Yet you're charging, you're saying you give them $20 an hour, but they're really only making 16. It's crazy.
Yeah, I mean, we had very few issues over the 7 or 8 years. You're always going to have an issue somewhere, but we had very few issues, and people stayed on the policy. And for many years, our rates didn't go up for the employees.
No,
The
and
rates
your
stayed the
overall
same.
went down several of the years. Yeah, because by doing things right, you're able to take control of it, and it allows you to, when you have to go to another insurance carrier, to decrease the cost. And you never have to decrease the benefits because you're controlling that 100%.
Okay, so I hope that was informative as I thought it was, because I didn't know much at all about what was possible in the health insurance world and how much you could save each employee as well as the company. Goes right to the bottom line. If you would like to reach out to Claimlinx, their 1-800 number is 1-800-858-1772. Or you can get online and reach them at claimlinx.com. That's CLAIMLINX.com. Reach out to them, talk to Tom, talk to his team, whatever you prefer, and just see what the opportunities are for your business. As always, carry on. God bless. Make this day the best day of your life, because we're not promised tomorrow. I'll see you next week.